Whether you're training for the Boston Marathon or just toughing it out as a weekend warrior, you may be pushing through unnecessary pain. That's where Spaulding Rehabilitation Hospital can help. Joining us now is Dr. Joanne Borgstein, Medical Director at Spaulding Wellesley Outpatient Center. Dr. Borgstein, thank you so much for coming in.
Thank you very much for the invitation. It's perfect timing with the marathon coming up.
It certainly is, and I'm sure that there's a lot of confusion out there for whether you're a marathoner or a weekend warrior. What are some of the top training mistakes that people make?
A combination of factors, actually. One of the biggest mistakes that people make is to push through pain, especially if there's local pain over a bone, let's say in your foot or in your leg. That may indicate a more serious problem, and it's good to listen to your body and get assessed. People often push their training too fast, too much distance, too many hills, and they're not adequately prepared for it.
What new treatments and research are out there to help people?
Actually, it's an exciting time. I'm a non-surgical specialist in sports medicine, and we have new treatments to identify with ultrasound injuries to the tendon or the connective tissue or the muscles. And we have newer injection treatments. We use growth factors that we harvest from people's blood that are concentrated in the platelets, and then we can inject and try to heal some of the more nagging chronic injuries.
So how does Spaulding help the average person who might be experiencing pain?
I think the most important thing is to have them come in and get evaluated. And we have a good team, and we look comprehensively at their biomechanics, at their alignment, at their strength, their flexibility, make an accurate diagnosis, both medically, and then get them going again with really good therapy and training.
So how long should somebody wait before they actually call the doctor or they come into Spaulding? Because, you know, sometimes you might go for a run and you feel a little bit of pain, you think, oh, that's really nothing. I mean, if it persists, or even if it's just a one-time deal?
I think you have to use a little judgment. This is the general guidelines that I give. If you're achy or stiff or sore the next day, that's okay. We expect that. That's usual post-exercise soreness, especially if you've changed your regimen or your training goals. On the other hand, if there's neurologic symptoms, any sense of weakness or numbness or tingling or shooting type pain in the leg, that should probably be evaluated. Or something very sharp and focal, such as in one of the bones of the foot or in the leg, that also should be evaluated.
Well, Dr. Borgstein, you couldn't have come in at a better time, so thank you so much for your expert advice. And I'm sure you'll be getting a lot of calls after the marathon. To learn more about what Spaulding may be able to do for you, go to spauldingrehab.org.